this is Dr. Naz. I am a physical therapist and the specialty here is on pregnancy. So this video I'm going to talk to you about belly breathing and muscles that utilize your diaphragm. So your diaphragm is your primary muscle of inspiration, but a lot of times we can use our accessory muscles of inspiration like our neck muscles, and then this is underutilized and it leads to low back pain. So if you saw my previous video on the core, that would be helpful to watch before you do this video, because we're going to use this as an exercise in a way. But first we'll just start with how to belly breathe. So what you're going to do, I'll just show you from the side. You can be sitting in a chair, you can be comfortable on your couch, whatever you want to do, and then we'll start in a sitting position and then we'll go down to lying down. So your diaphragm sits right under your rib cage and it's kind of like a tent. When you take a breath in, the diaphragm comes down. When you take a breath out, it balloons back up. So if you think about this muscle working when it comes down, you're working against gravity when you're sitting or standing. So it'll be a little more challenging, but it's good to challenge your muscles. So sitting here, I'm gonna put one hand on the chest and one hand on the belly. As I take a belly breath in, the belly should rise, and when I take a breath out, it's going to fall back in. So it'll look something like this. If you notice, my breaths are a little exaggerated. Reasoning for that is I'm actually using this as an exercise rather than just regular breathing, so that when you challenge your diaphragm to work, when you breathe normally, it'll be automatic. So we're gonna practice this lying down because it's a little easier to learn and it's maybe a little easier to see as well. So when you get down to a lying position, I may have gone through this before, but you want to use this progressive log roll approach where you use your arms and you use your body, your upper body, to get down to a lying position, and then you want to roll onto your side. So we're going to practice 5 belly breaths here, and I want you to do them with me. So if you have a mat, or if you can get down on the floor, or even just lie down on your couch, that would be perfect. So as we take a breath in, it's going to take 2 seconds to take that breath in. We're going to hold it for a second or two and then blow it out over 4 seconds. On the exhale, you want to tighten your core muscles all the way so that you're really engaging everything before we take our next inhale. So to go ahead and take a breath in with me. So you'll now go ahead and do one, and I'll just count with you. You're going to take it, inhale in, 1, 2, hold, hold, and exhale, 1, 2, 3, 4. That's kind of how it's going to look. So now we'll do 4 more of these. It's a little hard to breathe and count out loud, so I'm just counting in my head. Take an inhale on the count of 1, 2, hold, hold, and then exhale over 4 counts, 1, 2, 3, 4. Let's do 1 more of those. Now I'll have you get into a 4-point position. This is another way to strengthen your diaphragm. Your hands are going to be under your shoulders and your knees are under your hips. As you take your belly breath in, the belly's going to fall down, and then as you take a breath out, everything's going to tighten back up, and you're going to hold those muscles really tight, holding your lower abdominals for a count of 2. So go ahead and take a breath in. And exhale. On your inhale, it's going to be a 2 count. Hold for 2 counts, and then exhale 4 counts, and we'll hold for 2 there. So take a belly breath in. And inhale. I want you to practice starting with 10 belly breaths lying on your back, 10 belly breaths on a 4-point position, and then just practice belly breathing throughout the day, sitting or standing. Like I mentioned earlier, those are the harder positions to do, but they will challenge you and they'll strengthen those muscles, which will help throughout your pregnancy as well. This is something that can also calm down the nervous system. So your diaphragm is it's innervated by the phrenic nerve, which is a portion of the vagus nerve. And what happens when you take a belly breath, or you take 20 belly breaths actually, it stimulates the vagus nerve, which is the only nerve that exits the brain, or the only cranial nerve that exits the brain. When that nerve gets stimulated, it sends a release of hormones that calm down the nervous system, or your autonomic nervous system. So that fight or flight, it'll actually stimulate the parasympathetics, which will cause that rest and digest, and it'll help make you feel good. So if you're feeling really like anxious, or you're feeling like you're in just this pain cycle that's not getting better, you're having a hard time falling asleep, any of those times would be a perfect time to practice your belly breathing. So 20 belly breaths is a lot. It's probably good to do it lying down because it's not uncommon for you to feel lightheaded. So I hope that was helpful. If you have any questions, please just comment below, or if you like this video, I'm going to be building on this and going into some more core strengthening exercises in my next videos. So subscribe to my channel if you think this information was useful, and thanks for listening.